Hey guys and gals, Dr. Pete Stover here. Here we are sitting amid COVID-19, the map as of today. Getting ready to go do a little social distancing, which means fishing out in the middle of nowhere, which is why I'm wearing camo. I don't normally wear this to work. But I thought I'd just take a minute, shoot a quick video, send out some encouragement, some positive vibes, especially to the young docs out there or nearly docs, guys about to graduate, just to kind of shine some light on things, maybe hopefully give you a better perspective. So again, we woke up. Normal has changed, but this isn't the first time. I'll tell you a little story. In 2001, I was a third year dental student. I just got married and come downstairs from the gym at my dental school, and on TV, what do we see? We've got the 9/11. So the Twin Towers had fallen, and in one day, we had gone from what we thought to be the normal life to I remember driving home that day, sitting in line for about an hour to get gas, paying somewhere around $5 to $6 a gallon for gas. No more airlines flying. Everything was shut down. So much like we're feeling right now, the world had just flipped on its head, and things would never be the same again. And that's true. Things did change, and things have never been the same again. But it's just kind of a new normal. And so, one thing that happened that I'd like to remind you about is the stock market tanked after 9/11, you would expect. But something crazier happened. It took all of 57 days for the stock market to return. And so we went from the world is ending to, the new norm was, hey, we're going to make it. Everything's going to be fine. Coming out of dental school around that time, it's pretty nerve wracking to think how am I going to make a living? How am I going to take care of things? And I would say dentistry did fine. Matter of fact, from that time, we've grown to the point where now private equity groups are wanting to get into our field because it is a stable, viable field, and we'll recover. It'll get better. So one thing I'd like to do is, instead of having us sit around and look at COVID maps all day, I want to share some of just the little nuggets and pearls of wisdom that I've kind of gathered over the last few years. Because one thing you can control is the bottom line. You can't make patients come in, but we can be more efficient and try to trim our overhead and try to make sure we're running a tight ship, because I have a feeling that's what we're going to need to be doing for a while until everything gets back on its feet. So I'm just going to share some of the products that I've been using that really have helped my practice, and some options and things that especially help me with the bottom line that I feel like save me time. And one of the big ones is, this is a really neat product that I've come across, and they say time is money, and I believe it. And in the dental chair, that is absolutely true. So this product comes from Curari, which has been making clear fill for years, one of the most trusted bonding agents on the planet. Well, they have this clear fill quick, and it's universal. So instead of scrubbing for 20 seconds, it's got a 3-second scrub time. So basically, once you get it on the tooth, it's good to go. Now, I'm an etcher. I like the selective etch everything, the enamel, and then I let the bonding agent do the work on the dentin. And so all of 3 seconds, get a high powered curing light, something that could take over a minute to get a tooth ready for composite. Now it can be done in a matter of seconds, which doesn't sound like a lot, but when you add up how many composites we do in a year, that's kind of the bread and butter of modern dentistry. You're saving a lot of time over the year, and that's just that many more procedures and that much more efficient you can be. One nice thing about this too is they come in a 3-pack, so you can buy these kind of bulk, which will again help bring the cost per drop down, which is what you want to do. And so something really neat about this as well is it pairs real nicely with this cement. I've just recently started switching over to this pretty much exclusively. The proof was in the pudding. I had an old Emax that had gotten quite a bit of recurrent decay under it. And so they came in, the patient, I didn't have time to re-prep and clean and take care of her that day. So I thought, well, I'll bond it back on. With the amount of decay that's under there, it won't be that hard to get off. And so she comes back a week or two later, and it's time to take this Emax off. And I thought, it'll just pop right off, no problem. I ended up prepping the entire thing off. So even with significant amount of decay under this too, this bonds to dentin really well. One of the other really cool things about this cement, it has the silane coupler already in it. So all you got to do is etch your Emax. You don't have to apply any additional agents to it. Same thing for zirconia. If you just use your IvoClean or your sandblast and steam clean it really well, you don't have to do any more treatment to it, and it adheres to just about everything. And so I've just really been happy with this. Cleans up well. It uses that MVP monomer, which Curari's been using for a long time. And so this has really simplified and sped up the process for bonding just about anything in my hands. Now, and as a side note, I don't sell anything or I don't get any money. I'm just a guy. I like to lecture on CAD/CAM and do things like that. I love teaching and helping. So I'm not trying to sell you guys anything. I'm just telling you all some things that have really helped my practice over the years. So something else that's really cool I want to show you guys, if we can get this pulled up. This is James Clem is a guy that he's an aesthetic guru for CEREC and veneers and things like that. Something that he taught and turned a lot of people onto is prepping your margins with finishing carbide. This is a 018 finishing carbide for when you go subgingival. And the reason for that is when you talk about speed and efficiency, when you go subgingival and you don't want to deal with a lot of bleeding, when you take a diamond subgingival, you're going to fight the bleeding like crazy. When you take a carbide subgingival, it is so much kinder to the tissue, and you can just take any house brand gel, Patterson Shine, they're Hemodent knockoff gels, whatever you want to call it, and you can dry this thing up and you're ready to go in no time. And so you don't end up having to use nearly as much cord and things like that, because I'm a digital guy. I've been a CEREC guy for years. But again, you're a new dentist, you're getting out. We need to, we don't really think dropping 160 grand on a scanner and a miller is a good idea. So I'll tell you right now, this has been one of the best products I've run across in a long time. See if we can get it to upload. So it's the Medit i500. So this thing, I bought it through CAD-Ray, whereas a lot of your scanners on the market, they're all coming down. Competition is really helping the marketplace, but you're still looking at somewhere around $18,000 to $20,000 for one of these, versus 30 to 60 or maybe more for some of the others. And I find that, especially if you're really just wanting to scan for single, double, multiple units, just your basic restorative zirconia kind of stuff, this thing is a rock star. The guys at CAD-Ray do a great job with training and support. And so if you're needing to get into digital dentistry but not wanting to spend a fortune, man, this is a great way. They also have some really neat things that they do with implants to help with restoring complex cases and things like that. I won't get into that, but this is something to look at to save you some money, keep you efficient, keep you in the digital world, because one of the perks to that is, in the digital world, you've got guys now, the cost of zirconia has come down so much. It is not hard to find good labs that'll do these posterior units for, I've heard as low as 60 to 80 bucks. Again, so you're keeping your overhead down, still providing a great product. The fit is going to be wonderful. I've used a Medit to scan a margin on a tooth that it's literally the only way I was going to get that margin, and it fit like a glove. So there are options out here like this. Something else worth mentioning here. So a lot of you guys, if you're getting into implant dentistry, I'm not going to knock the big companies, but oftentimes you can end up paying $300 to $600 for an implant. And I would argue that the technology has gotten to the point now where you don't have to do that. If you're placing implants and you want to what's the bottom line? There are some great companies out there, Blue Sky and Implant Direct, and a lot of those guys have already kind of started that. But I've come across one here recently that I want to show to you guys. It's IH Biomedical. They have a really neat implant that is called the iHex2. Let me get down to it. So what I really like about this thing is it has a real aggressive thread pattern, makes the drilling protocol easy. But one of the even cooler things, which I've only seen this on 1 or 2 implants, is it's going to save you money on stocking parts. So one thing it does, most implant companies, they'll have several diameters, obviously, and the screw in components, whether it's a healing cap or a tie base or an abutment, this diameter will have its own set, and they won't fit this one. It'll have its own set, which won't fit that one. So now when you want to stock up on healing caps or anything like that, you've got to get 6 of these, 6 of these, 6 of these. Well, iHex2 platform switches everything down to the same diameter. So all the parts, the same part that will screw into this implant will screw into that implant. And so that reduces inventory. It makes life so much easier on your assistants. If you need a 4mm healing cap, it's in the same drawer. They all fit each other and they all work together. So again, saves money, saves headaches, saves time. And so really cool product. Again, IH Biomedical. And if you're a newbie dentist and you want to get into implants, obviously you need some training. I'm going to plug a friend of mine here real quick, Dallas Implant Institute. Again, I don't make any money off of you going to his classes or anything, but Dr. Steve Williams, and there's several of these institutes around the country, but those are good places to go to get trained on how to really simplify and predictably place these implants. So I know right now we're all kind of locked down from the COVID world, but when it comes time to get back out and about, I highly recommend it. Get into the implant game and get trained, because that's, again, Howard Friend says it all the time. Really, the only 2 markets growing at double digits is aligners and implants. And I worry a little bit that after this, when people kind of tighten their belts, aligners may take a dip. So I think implants is still a safe place to be for helping patients and keep your production up. Last little plug, this is just my website. Feel free to drop me an email if you have questions or want to know more about any of this. This is just I'm going to try to start adding some videos here, just some little nuggets and pearls like that. If you got any benefit out of what I went over today, start checking back here. Again, it's brand new. I just put it together, but I just want to use it as a resource to help people, especially you young guys that are like, well, what do I do? How do I navigate these tough waters? Hopefully I can be of a benefit to you and maybe try to make you laugh along the way. So be safe. Don't stress. Obviously, that's a hard thing to say. One piece of advice I'll give you: a doctor friend of mine that worked at a free clinic that we did for a while. He would have patients come in and he would help manage their blood pressure, their blood sugar, and all that stuff. And oftentimes they would want antidepressants and things like that. And he said, "Here's what I want you to do. I want you to go home and write down all the things that stress you out on a piece of paper, and then divide that into 2 categories. The ones you can do something about, make a plan of attack, and let's do something about it." So that's what I'm trying to help you do here. Let's make a plan. Let's do things we can decrease our overhead. The things you can't, you put them on the other side of the paper and you pray. You give them to God and let him take care of them, take the burden off of you. So I'm going to encourage you to do that. Hang in there. We'll be in touch soon.